My name is Christopher Strother. I am the Director of Pediatric Emergency Medicine at Mount Sinai Hospital. So I think for children, the three biggest things that we see in the emergency department, it starts with things like infections. So the flu, stomach viruses where patients can get dehydrated, high fevers, those sorts of things, and followed by injuries, falls, broken arms, cuts, head injuries, things along that line. Another big one in New York that we see a lot of patients is asthma. We get a lot of visits for asthma, especially this time of year in the spring when the allergies are up. It's a tough question. I think, anytime that, your child's in pain or you're scared or you're worried about their safety, we're here for you. 24/7, we're there for anything you think you need to see somebody right away and you're not sure where else to go. I think the big things we worry a lot about, trouble breathing is always a reason to come into the hospital. Severe pain or injuries, really anytime you think your child's in trouble, if you're worried about their safety or their health, is a good time to come in. But the biggest ones, dehydration, like we mentioned before, difficulty breathing, and then major injuries. I think the biggest difference for a pediatric emergency or a children's emergency room is the people there. Our physicians are all pediatric trained. You'll see a pediatrician and many times a pediatric emergency medicine specialist, as well as the nurses. The nurses are pediatric trained, pediatric comfortable. If your child needs medications, an IV or a procedure, the people there are used to doing it and trained to do it in children. And then other staff like our child life specialists. These can be amazing people that help your child be comfortable. They can educate you and your child on what's happening and what's going to be next, help distract them during things, and just make the experience a lot more comfortable. So I think the expertise, the staff and the training and the focus on children are what really set it apart. We're lucky here in New York. Families are fairly lucky. There's a few choices here in New York. We have several children's hospitals in New York City and around the area. Other parts of the country, not so much. A major city might have one children's emergency department. A lot of places in the country don't have any. The majority, 90% or so of children that go to an emergency department in the US go to a general emergency department. So overall, pediatric emergency departments are a unique thing. We're lucky to have a few in the city, but the most emergency care is done in general emergency departments. So it's a special thing to have a pediatric specialist place to go to. I think there's a few things here. So one, sometimes you're worried, things look scary, you're going to go in right away. You just got to go, right? If you have a minute to think about it, first of all, I'd always suggest give your pediatrician a call if you can. It helps in a few ways. Sometimes, talking to your pediatrician or your regular doctor can actually keep you from having to go. Sometimes they can make you an appointment the next day or give you some advice that might allow you to stay home for this visit. But if you need to go, I think, be prepared to be there for a minute. Bring a charger, bring a book. These things can take a couple of hours. So, be prepared to hang out with us for a little while to get x-rays or tests that needs to be done or medications. But really, medically most important is, I'd say there's two things, is either bring or write down your child's medications. It's extremely helpful to the staff at the hospital to know what your child has taken already and when they took it. When you're giving Tylenol or Motrin, write it down. Let us know when it was last, if they have any allergies to medications, and letting us know right up front if they have any chronic medical conditions can be really important. For example, if your child has sickle cell disease, when you come into the emergency department for a fever, let us know right up front. First person you talk to, he has a fever and he has sickle cell disease, because that can change the way we approach a patient and the tests that are done. So really being right up front and being an advocate for your child's history, and bringing or writing down those medications can be some of the most useful things you can do for us when you get there. Yeah, absolutely. Really excited to actually. We just a few weeks ago opened a newly renovated space for children. We've increased the size of our children's emergency department, as well as redone the entire space wall to wall. So it's newer, brighter, cleaner, very child friendly. A lot of colors and aspects that make it soothing for children. And a lot of things that sort of make the experience calmer and safer for kids. Video tablets in the various bays. So we have something to keep the kids busy and distracted and calm. We actually have a whole wall with an interactive video in it now, for the kids to look at. It really makes it feel like a child safe, like a family environment. Other important features like We've created a low stimulation room. It's a single room, a little bit away from itself for children with autism or other neurodevelopmental challenges, where they can be quiet and calm and sort of away from the hubbub, as well as a brand new resuscitation space. So, the really large, high technology, advanced areas for our sickest kids that come in, where we can really take the best care of critically ill and really sick children. So we're really excited about it. It's a bigger space, it's a newer space, with all the things we think make it important and safe for our children. It'll make it a better experience for our families and our patients. I want to mention, in Mount Sinai, we have three pediatric emergency departments. Our newest one is up on the upper east side on Madison Avenue. That's the Mount Sinai Hospital. At the main building is where our newest, newly renovated and our sort of flagship emergency department is. But we also have two other pediatric emergency departments in your neighborhoods. Beth Israel down at Union Square, and on the upper west side, there's Morningside, which has a pediatric emergency department as well. And for the fact that all 8 or 9 of our Mount Sinai emergency departments, we keep in touch with how they take care of their children. So even if you're not in the pediatric ED, our pediatric specialists are working together with the other emergency departments to take the best care of your children and make sure that your child gets the best care wherever they can be. And just a reminder that, we're here, we are there if you need us. It's a safe space for your children in an emergency. If you're worried, if you're uncomfortable, we're always there to help.